Your lips play a major role in your overall appearance and the youthfulness of your face. As we age, our lips and lip area undergo a series of changes that can make our lower face look distressed, worn, and lax. But you don't have to live with it. In this video, we'll be talking about lip and lip aging and how to restore your lips to their natural, formal, youthful beauty. Stay until the end for a bonus segment where I talk about my lip surgery experience and other treatments that I do to keep my lips looking youthful. All right, let's get into it. Hi, my beauties. My name is Dr. Stephanie Capel, and I'm a board-certified, double fellowship-trained cosmetic dermatologist in Newport Beach, California. And as always, my content is non-sponsored. So let's first discuss lip changes as we age. As we get older, we go through a series of changes, not only in our lip tissue itself, but in the muscle and in the subcutaneous tissue and in the bony structure supporting the mouth. Now what happens is our skin thins all over our face, and it happens in our lips too. But this is why our lips look wrinkled, they look withered, they look shriveled up, they look thinner, they're dry, they're chapped, they're dehydrated. This series of changes that happen as we age occurs, and we have a thinning of the epidermis and the dermis and the subcutaneous fat and the orbicularis oris muscle, which is the muscle that goes around our mouth. That's when you use Botox to decrease the smoker's lines or perioral rhytids. That's the muscle that thins and becomes atrophic over time. And even if you look at our skull, the bony structure changes with each decade in life. I remember seeing this in my anatomy class in my first year in medical school. You see the mandibular and maxillary changes, which are the skull bony structures that hold the teeth, actually change significantly each decade through life. So that's why you'll see things like elongated philtrum, or you'll see an elongation between the nose and the upper lip, and that's a sign of aging. That's why a lot of plastic surgeons are doing lip lift surgery. I'm gonna look ridiculous when I do this, but they pull up the upper lip to kind of shorten the distance between the nose and the upper lip. A lip lift surgery will give a very youthful appearance without any filler or laser or any microcoring or any other treatments. That in and of itself, by shrinking that space, shrinking the distance between the nose and the upper lip, can significantly give a more youthful look. And that's why that makes us look more youthful. And there's other changes that happen in the lips as we gain wisdom and become wiser. As the skin thins and the mucosal surfaces become atrophic, you're not having as much hydration in the lips. Your skin is thinner, so you're going to show these little lip lines that even if you don't smoke, you can develop these smoker's lines, and you get these radiating perioral rhytids, or you'll get sinking in of the corners of the mouth, or a downturned angle of the mouth as the depressor aguli oris, or the DAO muscle as we call it, contracts and gets shorter. That's for a different video. But a lot of these changes happen as we age, and they kind of sneak up on us, because one day you'll say, why are my lips shriveled and dry and downturned and caving in? And it's because all of these changes have happened over time. But if you could adjust and tweak these little changes and offset these changes with still very beautiful and natural looking results, because if you're assessing the status of the changes that are happening around the mouth, in the lips, between the nose and the mouth, and you address each issue very precisely and over a slow period of time, you won't look weird. You'll look rejuvenated, and you'll look more natural, and you'll look more youthful without having that done look. So there's a joke, especially when you're talking about filler for around the lips. There's a way to do filler to smooth out the lines, but not giving you that Marge Simpson upper lip that everybody's running away from, and rightfully so. That's a terrible look. You want to rejuvenate the lips with a very natural looking aesthetic without looking done, just looking fresh and youthful and how you did 10 years ago. Another change that happens as we age is your blood vessels and the circulation to the lips become a little bit atrophic and less dense than they were before. So the red part of your lip is actually just from underlying vasculature. And as the collagen diminishes and the blood vessels kind of start to retract, you lose that kind of bright, beautiful color of your lips that you once had. And also preserving that vermilion border, which is the border between the white part of the lip, which we call the cutaneous lip, and the mucosal lip, which is the red part of the lip. When you have that border that gets blurred or ill-defined, sometimes that's the problem with lip blushing or surgical procedures to the lips. When you blur that definition, the lips just look off, and they don't look real, and they look altered, and they look weird. So really helping to keep that line of demarcation, which we call the vermilion border, is really, really important in aesthetics. I'm talking to you guys how we talk among colleagues when we're at aesthetics meetings, and how they teach us when we're in fellowship. You always want to keep that vermilion border defined. And when you blur that, it can look artificial. So as we age and we lose that red component to our lip, by adding in a little filler to that area, it actually can brighten up the color of the lip and make the lips have a more youthful kind of pink, vibrant look, which is also very beautiful. Lip lines and lip wrinkles. The reason why we form lip lines, even if we're not smokers, we can get what we call smoker's lines, because as the skin thins, the skin folds on itself. Skin's kind of like cardboard. The more it folds on itself, the deeper, more etched in those lines get. And it becomes more apparent as the skin thins over time. So it just happens from talking, using our mouth, eating, chewing, and just being human and using our mouths. And even if we're not smokers, these lip lines will form because our skin thins with time. So the best way to treat those is a combination of different things. Now, some people don't like filler, and I'm actually not a big proponent of filler, but when done correctly for the correction of lip lines, especially with my patients, I'm able to erase those lip lines without making the patients look done or like they have added volume to their lips. But it took me 15 years of injecting to get to this point, but I got it. But usually the way we do that is by adding a little bit of filler into the lip lines to erase them. And if people don't want to go the filler route, you can use lasers, resurfacing devices. You can use a CO2, which is an ablative laser, or a Fraxel or non-ablative, or you can use microcoring, which is the new Ellacor technique, which we're having great results with people having their lip lines erased with 1 to 2 treatments of Ellacor. It's great for that. And there's a lot of other treatments too. Even just doing a little neuromodulator or a little Botox around the mouth or the bicularis oris muscle can help relax that tension so you're not forming those creased lines. And even doing it more preventatively when you're younger, it can help, minimize that muscular contraction that's going to fold that tissue. And it's like 4 units of Botox. It's really, really minimal, so it's not a lot, but it goes a long way to prevent those creases and lip lines from forming. So lip wrinkle removal treatments, as we already discussed, usually include filler, neuromodulator, lasers, microcoring. We can even do chemical peels, even a phenol peel, which is a very deep peel, but when it's very localized to around the mouth, has very beautiful results. And also, using high quality skincare products, which usually aren't going to compare to an in-office procedure, but complement in-office procedures to keep that area nice and smooth and wrinkle-free. So let's talk about laser resurfacing for lip lines and lip wrinkles. As we mentioned it before, you can use a fully ablative like a CO2 laser or an erbium, or you could use a non-ablative like a Fraxel or even a hybrid like a Halo. Now, what laser resurfacing does is it stimulates collagen synthesis, which helps smooth out those lines. And the way it does that is by inducing the fibroblasts, which are the collagen producing cells, to make extra collagen and help fill in the gaps and help replace the old disfragmented collagen with healthy, fresh, new collagen, which is going to give lips that nice smooth texture. And when it's fractionated, it just pokes thousands of tiny little holes in the area, so it looks like there's a little pinpoint bleeding, but it gets repopulated by the surrounding skin, which is full of collagen and elastin and extracellular matrix proteins and glycosaminoglycans, which gives skin that smooth, sturdy turgor and structure. So many times with laser resurfacing, people will only come in and just have that one area done. Now, people will ask a lot of times, Dr. Kappel, if I only have my around the mouth lasered and I don't have the skin next door lasered, is there going to be a discrepancy? And the answer is no. A true laser surgeon and expert knows how to feather and decrease the settings. What we do is we'll hit the wrinkled area harder around the mouth, and as we progress towards the non-lasered skin, we decrease the setting, the energy, the joules, the fluence, and the depth and percentage of treatment, and what we call feathering. We kind of feather it into the surrounding skin so it blends very beautifully. It's almost like an ombre laser, if you can think of it that way. There's no sharp line of demarcation. So that's nothing to worry about, because sometimes people will just have a fully ablative CO2 just around the mouth, or just have a Fraxel full face and have a little bit more, aggressive treatment around the mouth, which is a more problematic area. Under the eyes is too. So let's talk about filler for lip lines and lip wrinkles. Everyone worries about looking overfilled when having this done. And again, as I mentioned earlier in the video, I have a technique and a certain way that I fill in lip lines to just smooth out the lines, but not add that extra volume, because the last thing you want to do is have that Marge Simpson upper lip, or have that duck lip, or that over volumized upper lip with the red part of the lip looking smaller. So there is a technique to it, but it is possible, and filler does a great job of helping to erase and smooth those lip lines. Another thing that I do when I'm actually injecting the lips is you're not injecting filler sometimes to add definition or volume to the lips. You're basically just using it as what we call injectable lip gloss. So what we do is we put a little bit of filler, a very thin low G prime filler like Vobella, and we put it in the lips not to make them bigger, not to add definition, but just to reinflate the balloon, as I call it. If your lips are wilted and withered and kind of pruny looking, it's because you've lost hyaluronic acid, glycosaminoglycans, collagen, elastin over time, and that manifests with not lip wrinkles, but a lip deflatedness. So when you add in a little bit of volume, it just plumps the lips out to go from wrinkled to smooth, and that's a really beautiful, natural looking lip filler. And so most of my patients, I always take pride in the fact that most of their husbands don't know that they're getting filler, and rightfully so. Husbands are worried that their wives are going to come home looking crazy. I just want to give it a plumping effect, not to look done, but just to take it from a wilted and withered look to a plump and smooth and full look. And that's the way you erase lip lines and lip wrinkles within the red part of the lip. So you still look natural, you don't look like anything's been done, your lips just don't look wrinkled anymore, they just look smooth and plump like you have lip gloss on. So let's talk about lip volume. So a lot of people want lip volume and a lot of people don't want lip volume. I always say go within the natural confines of your lip anatomy. If someone comes in and they want bigger lips than nature intended them to have, I just say I'm not your provider. I know that there are injectors out there who will perform this, but I'm very natural looking, and I like my patients to look about 10 to 20 years younger than they are, and like nothing has been done, and that's the true key to injectables and these in-office procedures. Now, there's a time and a place for lip filler if you want to erase lip lines and lip wrinkles and when you want to add volume. So those two are not the same. If someone wants to enhance their lips by having increased volume in their lips, there is a very natural, conservative way you can go about doing it, but this is different than lip line and lip wrinkle treatments, because if someone wants increased lip volume, it's going to make your lip lines and lip wrinkles look better. But if someone just wants their lip lines and lip wrinkles erased but doesn't want the increased volume, there's just a different technique that we have to adjust to accommodate for that. But it is doable and it is possible with a skilled injector. Let's talk about lip hydration, especially now that we're in the fall and entering winter months. Lip hydration is really important and something that we lose as we get older, because we lose that hyaluronic acid and we lose those glycosaminoglycans that hold water and bind water and hold them within our mucosa and within our skin. So it's really important to use a lip mask or a lip balm, and we just recently engineered the MDR lip mask that is a peptide containing mask that I'm super excited about, because I know exactly what the lip skin needs and I know exactly the vehicle delivery systems that are needed to get it there, and it's one of my passion projects I've been working on for my patients who struggle with dry, chapped lips. Also doing a little bit of filler, especially Vobella. For those of you who don't know this, fun fact, FDA approval was given to Vobella for lip hydration. And I actually have mentioned this before, I have a full-on mountain man who comes in from the mountains and gets his lip filler once a year to maintain lip hydration, because hyaluronic acid fillers pull water into the mucosal surfaces of the lips and in the lips to hydrate the lips. What treatments to consider for your lips by decade? So this is an important question. What things can we do to be preventative or to be reactive if these changes have already happened? Now, I feel like I could speak freely about this because I actually did this in my 20s, and now that I'm in my late 40s, I'm really glad I did. And in my 20s, I always did a little preventative baby Botox just around my mouth to decrease that harsh muscular contraction. Look, I still can't even do it, because the more your skin contracts and folds on itself, those etched in lines start to form, and they're more difficult to erase once they've already been established. But you can be preventative by doing a little bit of baby Botox around the mouth. Lip flip is another way to kind of make the lips look fuller without filler, and when doing so, you're actually also giving a double, whammy with having a little lip line preventative treatment as well. And a lot of my younger beauties do gummy smile Botox, where when they smile and a lot of their gums show on their upper teeth line, a gummy smile Botox is a really popular Botox treatment that I give to my younger beauties in their 20s. But I would say wear lip masks, protect your lips from the sun. Don't forget to put sunscreen or use a chapstick or lip balm with sunscreen when you're out in the sun, and that's probably the most important things for your 20s. And of course, maintaining hydration. Now for my beauties in their 30s, usually this is the time when you may start to see a little lip line showing. You may need to do a little preventative filler, not to erase the lip lines, but to provide some structural support, and you wouldn't inject it this way. You'd inject it kind of like cross-hatching it to provide a little structural support so that your skin doesn't fold and cave in those lip line areas. So I feel like that's a really important and really beneficial kind of proactive treatment that you can do in your 30s, in addition to some type of laser resurfacing just once a year. Even if you don't do a full face, Fraxel or Clear and Brilliant, just doing a little bit around your lips to keep the collagen stores up, I think is a good preventative measure and can help soften any lip lines that are starting to appear at those early ages. So in your 40s, if you're starting to see some lip lines really kind of becoming etched in there, I also, usually recommend a little bit of filler to erase them. Again, maybe instead of a Fraxel or a Clear and Brilliant resurfacing, you might want to go to a CO2 resurfacing, depending on how severe those lines are. And it just depends on the person, not just on their age, but their environmental exposures, how much sun exposure they've had, and the thickness of their skin. But for the most part, in our 40s, we're going more towards, corrective filler instead of preventative filler, and we're going more towards a Fraxel or a CO2 instead of a Clear and Brilliant or a Fraxel. So for my beauties in their 50s, usually, again, probably a CO2 or a Fraxel around the mouth and a little bit of a corrective filler. Sometimes we're needing a little bit of filler in the lips if the lips are starting to kind of cave in and become wilted and withered, just to kind of plump them back up and provide that structural support that's been lost. And my beauties in their 60s, sometimes, we'll need a little bit more than just an ablative laser or a CO2. We might move to Ellacor, which is a microcoring technology that actually removes little pieces of skin in a scarless fashion, and it's a skin excision. It's kind of like microneedling, but I'm not a big fan of microneedling because that's usually underwhelming results. Microcoring is like microneedling, but with hollow needles that actually removes little pieces of skin and kind of shrink wraps the skin, but it's really great for erasing those really etched in deeper perioral lines or smoker's lines. So for my patients 60s and 70s and beyond, it's usually Ellacor plus or minus a corrective filler as well. How to remove lip wrinkles naturally at home. Honestly, you guys, it's by just hydration, drinking a lot of water, using your sunscreen every day, making sure that you're using sunscreen on top of your lip balm or chapstick that you're wearing, and then also using a peptide-infused mask, lip mask, like the MDR mask that's going to have peptides in it, and that's going to increase your collagen stores and all of the glycosaminoglycans that are in the lips that naturally start to diminish with time and that naturally start to dehydrate the lips. So you want to increase the upregulation of hydration of the lips by using at-home products like lip serums and lip balms, as I mentioned, and then also maintaining your hydration status, of course, by drinking lots of water, at least 2 liters a day. So let's talk about a long fill trim. So as we age, the distance between our nose and our upper lip elongates and it gets longer, and that's a sign of aging. And shortened distance between the nose and the upper lip is a sign of youthfulness and beauty. So a lot of plastic surgeons and dermatologic surgeons, like myself, will perform lip lift surgery in the office. It's an in-office procedure, and they remove a little piece of skin between the nose and the upper lip, but at the more superficial, superior area here, and it just shortens the distance between the nose and the upper lip. I've actually had this surgery done by a good friend of mine who's a plastic surgeon, and I did it when I was 41 years old. I'm 46 now, and it's one of the best things that I've done because I'm not a big proponent of lip filler. I love doing lip filler on my patients and my beauties, and I feel like it's a very natural looking procedure when I do it on them. But for myself, I do maybe a half a syringe of Vobella in my lips every few years, but I'm not a big lip filler person, but I have had lip lift surgery. Now you can see it just kind of pulls up on the upper lip, but it just helps decrease that distance between the the nose and the upper lip, which gives a really beautiful, youthful look, especially for those who don't want any filler. It just shows more of that red part of the lip, so that just makes us look more youthful, and it's just a more aesthetically pleasing outcome. Let's talk about Botox Lip Flip, because Lip Flip Botox is different than Gummy Smile Botox, and people always get this wrong. Gummy Smile is at the apical triangle right here, and that helps keep the lips down and not the gums showing so much if you have a gummy smile. Lip Flip is usually 1, 2, maybe 3 units per side on each side of the upper lip right here. And what it does is it prevents the orbicularis oris muscle from contracting and curling in. So if you're one of those people who you smile and your upper lip disappears and becomes a little thin line, you're a good candidate for Lip Flip. If you smile and your lip doesn't really curl under, then you're not really a candidate for Lip Flip. But what you do is when you do Lip Flip Botox right here, is it just keeps the upper lip fuller when you smile. So I guess mine curls up a little bit. So I guess I should probably have some Lip Flip Botox. I don't have any in there right now, but that's how you know if you're a candidate for it, and that's the outcome of it. Going back to a long fill trim and other procedures that can help shorten the distance between the nose and the upper lip and shorten the fill trim. Aside from surgery, because let's face it, a lot of people don't want surgery. It leaves a scar. I even have a scar here. If you look closely, you can see I have a lip lift scar, and I fraxeled it though, so it's hardly noticeable now, but it took like 4 Fraxel treatments to get it to be inconspicuous. But Ellacor is a great device and a microcoring technology that helps decrease the distance between the nose and the upper lip without surgery. So I love it for that. Patients who we do lip lift with microcoring and Ellacor have great results. They don't have hardly any downtime. It's like a week of, of bruising and swelling, which is bad, but it doesn't compare to like a surgical downtime. And they get beautiful results with a beautiful aversion of the upper lip. So I love Ellacor microcoring for a non-lip lift procedure without a scar and without having to have surgery. So Ellacor is one of my favorite treatments for that as well. Okay, let's talk about my lip lift experience. So I had my lip lift surgery several years ago. It was performed under local anesthetic, so I was awake and oriented during the whole procedure in office. It was done by Dr. Monica Q, who's a very good friend of mine. She's a plastic surgeon in Newport Beach, and she just removed a little bit of the skin underneath my nose and kind of put it in the suture line under the nose. And as you can see, I have a little scar there, but it's barely noticeable because I've fraxeled it and I V-beamed it about 3 or 4 times. Of course, I'm obsessed with laser, so you could barely even see the scar. But I feel like it was one of the best things that I've done to give me fuller, natural looking lips, and I don't have to do a lot of filler, which is the good part. I just do maybe half a syringe of Vobella every couple years. I inject my lips myself, but I feel like the lip lift surgery gives a natural, beautiful aesthetic look that I've enjoyed over the last few years. So treatments I do to keep my lips looking young. So we have already talked about my lip lift surgery. I've not had Ellacor yet, but I'm tempted to do it around my mouth because I just want to see the results, and I see everybody having amazing results, so I want to do it myself. I have not yet done that. I do a half a syringe of Vobella every few years to keep my lips hydrated and plump and wrinkle free. And when I was younger, it was funny because I don't do it as much now that I'm in my 40s, but in my 20s and 30s, I always did a little perioral Botox to help with lip lines. So I actually don't have any lip lines. Well, hopefully I don't. And I don't have any Botox in my lips either. But I feel that I did a lot of that, like I front-loaded my preventative treatments in my 20s and 30s, mainly because we were dermatology residents in UCLA and we were practicing on each other, but we were unintentionally giving each other preventative treatments. So I basically could drink through a straw, and with all of my decades of talking and chewing and drinking through straws, I really never formed lip lines, but I really do believe it's because I was always doing perioral Botox, maybe like 2 or 3 times a year to kind of keep that area quiet and to keep that skin from folding on itself. So that's what I've done to prevent lip lines from forming. I've also done Fraxel laser and Clear and Brilliant lasers very regularly across my whole face, and we always do extra passes around my mouth and under my eyes, which I think I've helped now in my 40s. All that stuff I did in my 20s and 30s. But that's just because I had early access to it. It doesn't mean that if you're in your 40s, 50s, 60s now and you didn't do those things, you can always reverse it. I just, was taking a more preventative and proactive approach, really unintentionally, because again, we were just practicing on each other and doing these treatments on each other. But I did do a lot of laser resurfacing, and I still will do a Fraxel at least once, maybe twice a year, and I always do extra passes or extra treatments under my eyes and around my mouth. So that's helped me maintain a youthful appearance to my lips as well. And at night, I always wear a peptide mask. I really like peptides. I'm not a huge growth factor person because by training, I'm a Mohs skin cancer surgeon, and we would always take our skin cancer patients off growth factors and exosomes. So I like peptides. I feel like they're more elegant, they're engineered more elegantly and more specifically, so you don't have to worry about the risk of a neoplastic activity or a neoplasm forming. That's just the way that I've been trained. So I really love peptide masks that are going to allow those keratinocytes and the mucosal cells in the lips to hold on to water, minimize transepidermal water loss, provide an occlusive kind of barrier as we sleep. And when I was younger and I couldn't afford lip masks and I didn't have all these things, I would just use Aquaphor. So basically in my 20s and early 30s, I would use Aquaphor Vaseline around my lips every night. And now that I'm older, and I've engineered my own skincare line, MDR, I use the MDR Lip Peptide Mask, which is not yet launched but will be launching soon. But any mask that has smart peptides in it or has some type of barrier restoration that will hydrate the lips from within on a cellular level is really, really key. So using that every night I think has been really, really helpful. So preventive Botox, lasers, filler, lip masks. Let me see if I'm forgetting anything. I think that's it for my lips. So, and just, you know, wearing sunscreen on my entire face and my lips every day has really helped with that as well. So those are my tricks and secrets. Hopefully I didn't leave anything out. If I did and you want to call me out on it, you can leave a comment in the comment section. But I think that's pretty much it. So thank you so much for joining me, and we look forward to seeing you next week. And again, thank you so much for your support, and love you guys.